threat of proposed state budget cuts are starting to have trickle-down impacts on local agencies.
MTN's Augusta McDonald joins us now. She has more on what the latest is. Augusta?
There is a lot that's still unknown about what will happen next with the current budget shortfall facing the state. What we do know now is that some agencies are taking action to eliminate funding for programs already on the chopping block before official budget cuts are even being made by lawmakers or the governor. The Foster Child Health Program is a collaboration between Providence Medical Center, Missoula County Health Department, and Child and Family Services. They received surprise notice on Friday that half of their funding, which comes from the state, was ending effective immediately.
What we were really surprised was to learn that the funding was cut in advance of that decision actually being made. We didn't expect that. We're partway into our fiscal year. We have kids on caseloads that need to be served.
That's 50 to 60 cases that these healthcare providers work together on to provide critical services to vulnerable kids.
Very important program that we have to really ensure that not only the foster child health needs are met, their medical, vision, dental, and any special needs they may have, but also it's a support for foster families when they have children come into their home that they don't know their medical history. That public health nurse visiting the home really allows a resource for the foster parent that also stabilizes placements in a very positive way for children.
Grossberg says all three partners have a financial investment, so the program can continue as long as the health providers can piece together a way to fill the $65,000 gap left by CFSD eliminating this funding.
Maybe lower some of the intensity of the visits with the kids. We'll be looking at if there's any private partners that wish to support it and get us through this time. We wait for the decisions. What we're not going to do is abandon the children.
This program has coordinated and provided the health care needs for 600 foster care kids in Missoula County since 2011. There's no word yet from Governor Bullock or the legislature about whether there may be a special legislative session to address budget shortfalls. Until then, $105 million worth of funding for Department of Public Health programs like this one are waiting to hear whether they will be able to continue their work with Montana's most vulnerable populations. Reporting in Missoula, I'm Augusta McDonald for MTN News.
The cuts also eliminate similar services for foster kids in Yellowstone and Cascade County.